Good afternoon. Welcome and thank you all for being here. I am Sherry Greenberg, and I have the honor and privilege of being the chair of the board of Central Health. I want to thank the members of the Community Health Champions class of 2020 for your commitment to Central Health's mission. We deeply appreciate you. We have some alumni members with us today, and like them, we hope that this isn't the end of your involvement in Central Health's work for you, but the beginning. And we are so privileged to have you as part of our community, the Central Health community. We look forward to continuing to work with you to improve the health of all residents of Travis County. Before we jump in, I would like to acknowledge my fellow board member, Maram Musaitev, who I believe is with us here today. Thank you all for being here for this special celebration and for being part of our community health champions. Today, we celebrate our health champions, so let's get started, and I'll turn it over to Yvonne Davila. Yvonne?
Thank you, Chair Greenberg. We appreciate you being here, and thank you for such wonderful remarks. Good afternoon, everyone. My name is Yvonne Davila. You all know me. I'm Director of Communications and Community Engagement at Central Health. Like our chair said, we hope this is the beginning of your involvement with Central Health. We are so excited to see the work and collaboration that this class will have in store beyond this program. As you all recall, at the beginning of your program, you participated in a 2-day health equity training session. And it was a virtual session. In fact, the entire program was virtual, and we are so appreciative of y'all, your flexibility and sticking it out and sticking it through the entire program. During this health equity training session, you learned the history of health disparities in the United States and went through several reflection exercises that shed light on the magnitude of efforts to take place to achieve health equity, as well as our individual responsibility as gatekeepers in our respective roles. Since you began the program, Central Health has made strides to make health equity a priority at the enterprise level. Last year alone, we created an equity and inclusion task force made up of employees across the enterprise. We updated our value of respect, which is now right by all, and reads, by being open, anti-racist, equity-minded, and respectful in discourse, we honor those around us and do right by all people. We also approved a business case that will bring equity training to all enterprise employees, a business case written by fellow health champions and now fellow health champions alumni. We hired a diversity and inclusion manager to help shape and lead a robust DE&I strategy for the enterprise. Jana Allen was previously part of the Communications and Community Engagement team, and she was hired as our diversity and inclusion manager back in December. There's much work to be done, but the collective consciousness around health equity throughout the enterprise keeps getting stronger, and we will continue to rely on our health champions, the Central Health Equity Policy Council members, and community advocates as we work toward a more equitable health system for Travis County residents with low income. With that, I'm going to turn it over to my colleague, Jana Allen, Central Health Diversity and Inclusion Manager. Jana.
Hello, thank you, Yvonne, and thank you all so much for being here. It is truly a pleasure to get to be with you all at the end of this session. And I just want to commend you all on being able to adapt to a virtual environment and some of the changes that I know you all have had to make in life to keep up with the program in response to COVID-19. So once again, good afternoon, everyone. And it is my honor and privilege to serve as the first diversity and inclusion manager for the Central Health Enterprise. But before we get into a little bit more of discussion, I'd like to acknowledge the diligent work of my fellow employees, community advocates, activists, partners, and Health Champions alumni who have all been advocating for equity and inclusion within Central Health and throughout Travis County long before I stepped into this role. So thank you all so much for all that you've done. During the early months of COVID-19, the pandemic that we're all coming to know so well, author Sonia Renee Taylor wrote, "We will not go back to normal. Normal never was. Our pre-corona existence was never normal, other than we normalized greed, inequity, exhaustion, depletion, extraction, disconnection, conclusion, rage, hoarding, hate, and lack. We should not long to return, my friends. We are being given the opportunity to stitch a new garment, one that fits all of humanity and nature. As we hold this celebration virtually and we look at each other's faces through our screens and from the comfort of our homes or our safe environments, we are constantly reminded that we have not gone back to some of the normalcy that we knew prior to the COVID-19 pandemic. At the same time, this virus has amplified the inequities that many normalized and became numb to. COVID-19 amplified the stark health disparities in our nation as Black, Indigenous, and Latinx communities experienced the highest death rates from this virus. And I know that as you all participated in the health equity training, you are aware that those inequities were by design. They were not an accident, and that we're seeing the ramifications of those policies and those procedures and the lack of attention today. And then in the midst of this viral pandemic, the nation's longstanding pandemic of racial violence surged yet again last summer. Following the deaths of Breonna Taylor, Ahmaud Arbery, George Floyd, Vanessa Guillen, and so many others whose names we do not know, the cries for justice for Black and Brown lives were heard and came to a head. Many city councils across the country, and our own Austin City Council included, passed resolutions officially declaring racism as a public health crisis. Meaning that we have folks, elected officials, finally acknowledging the impact that race has on the body, the impact that injustice has on the body, the impact of what happens when folks are continuously pushed to the margins because of their identity, that this impacts their health outcomes, how they access care, and ultimately the longevity and quality of their lives. Going back to Ms. Taylor's quote about stitching a new garment, one that fits all of our humanity and nature, before we can stitch this new garment that she describes, we must understand exactly why the current garment does not fit. We've been given a system of policies, of procedures that we all know has not been made to center our vulnerable populations. Vulnerable populations, folks from religious, from different minority communities, both ethnic and sexual orientation identity, people who've been pushed out to the margin and their experiences haven't been centered. And now we see the ramifications of what happens and how that affects health outcomes and our relations with one another. So what do we do? What do we do in light of that? It's a lot to take on, and it starts with us acknowledging and having awareness and then taking action. And I see all of these challenges, and I'm excited to step into this work with Central Health and alongside all of you, from us moving from the awareness that we now have about these inequities, from the acknowledgement of racism as a public health crisis, of all of the other isms as public health crisis that impact our bodies, to now taking action. Some of the ways as I step into this role that we plan to take action at Central Health starts with laying a sustainable foundation for this work. In light of all of the challenges that have been presented in 2020 and a lot of the conversation, it is very easy for this work to become reactive or just to become trendy or something that everyone does now because activism is becoming popular. But I know that Central Health, myself, and many of the health champions on this call, we are committed to this work being sustainable. So with that, that starts with aligning our diversity, equity, and inclusion efforts between our workforce culture and our health equity outcomes, the work that we're doing to serve the folks that Central Health is charged to provide healthcare for, along with what are the practices that we have as an organization in terms of recruiting, retaining staff, training around health equity, diversity, and inclusion, as Yvonne mentioned. What are the ways that we're doing our work internally to be an environment that more diverse staff would like to belong to and like to represent? How are we centering the experiences of our patients who have been intentionally pushed to the margins? In addition to that, we're completing an assessment of Central Health's current environment in regards to culture to shape these strategies that will enhance our diversity and inclusion efforts. And then we're also continuing to work with our Equity and Inclusion Task Force, comprised of so many amazing staff members, to create tactics to reach our identified goals for this coming year. And one of the key things as we get ready to take on this work will be creating shared language. I'm sure as you all saw during the health equity training, there are some things that have not been taught in US history. There are some things that have not been taught as far as the treatment of folks from marginalized communities. And so as we start this work, it's very important to me in this role to create shared language and a shared sense of history, a shared sense of how we've gotten to where we are, a shared sense of the experiences that folks in our patient population are going through on an everyday basis and why those are the way they are. So creating a shared language around these definitions of racism, of injustice, of disparity will be very important for every person in the Central Health enterprise to gain an understanding on so that we can move forward. With that, this is only the starting point, as I've been in this role for all of about a month now, and I'm looking forward to continuing the conversation with you all and providing updates to you all through Lunch and Learns, and just continuing to just keep the conversation going on the progress that we make on these efforts. I also look forward to continuing to part with you all as alumni on just keeping Central Health accountable to this mission, helping us to remain equitable and keeping us centered on those who need our services most as we keep going forward. And with that, I thank you all so much again, and I'll turn it over to Anais.
Thank you so much, Jana. Wow, I got the chills. That was so powerful, and we so appreciate you for joining us today. This was not in my script, but I don't know if we mentioned this earlier, but Jana used to be part of the communications and community engagement team before she moved over to be the first diversity and inclusion manager at Central Health. And when I met her in her interview, in the first minute, I knew that she was meant to be part of Central Health, but I did not know that she was going to take such big strides and lead our organization to just amazing things. So again, thank you. I love you, sis.
I love you. Thank you.
Without further ado, I'm going to share my screen, and we are going to get started with our certificates of completion. Our participants, the class of 2020, we have 31 graduates today, and they're receiving these certificates because they completed the requirements for the program, which means that they attended a 2-day health equity training, and they attended 3 out of the 5 workshops. And 31 of these graduates today, 9 out of the 31 graduates today, 19 of them are being recognized for perfect attendance. And due to a virtual program, we are very impressed with that outcome, and we're so happy that you all could join us today. So I'm going to get started, and the first certificate of completion goes to Miss Aliyah Al-Yafi with perfect attendance, Giovanna Alanis Vega, Lemlem Berhi with perfect attendance, Maria Brown Spence, David Burrows, Tina Byram with perfect attendance, Catherine Churin with perfect attendance, Arlene Cornejo with perfect attendance, Karen Downing, Sherelle Freeman with perfect attendance, Alexandra Garcia with perfect attendance, Omar Gomez with perfect attendance, Shelly Gupta, perfect attendance, Molly Hahn, Leslie Holmes with perfect attendance, Hui Lee, Cassie Longoria with perfect attendance, Asa Malik with perfect attendance, Laiz Milburn, Dr. Dan Nguyen with perfect attendance, Rhonda Reynolds with perfect attendance, Jose Luis Rodriguez, Regina Rodriguez, Phoebe Romero with perfect attendance, Pilar Sanchez, Taryn Sanchez with perfect attendance, Rebecca Sorensen, perfect attendance, Elijah Stroud, Mega Upal with perfect attendance, Teresa Watkins, perfect attendance, and last but certainly not least, Lourdes Zuniga with perfect attendance. Congratulations to the Community Health Champions class of 2020. We're so proud of you. Thank you so much for your commitment and your participation. And I will now turn it over to our VP of Communications, Ted Burton, who will present our special awards.
Thanks, Anais. Thanks, everybody. Wow, great seeing everybody going through those pictures and seeing everybody's names. It has been such a unusual year, not seeing people in person and getting to hang out before, during, and after meetings. And I miss that, and I have every confidence that things will be back to our new normal next year. So you guys are going to really be a historical marker for the health champs, having met virtually this entire time. But we are grateful for everything that you do for your community, and Anais and Yvonne have a way of making sure that once you're a health champion for life. So this may be the last class day or formal gathering, but you'll be hearing from us. I'm sure of that. Today, I have the honor of recognizing 4 special community health champions who've shown a commitment to this program that's above and beyond, and perhaps most importantly to us, a mission to the mission of Central Health, which is making sure that everybody in our community has access to quality health care, no matter where they live, where they're from. That we really do believe in healthcare as a human right and healthcare for all. So the first award is the Community Service Award. This year we have 2 Community Service Award recipients. These people have shown their commitment to our community in many ways. The first award goes to a person who volunteered not once, but twice during his participation in the program, helping put together PPE kits. And he also volunteered at our annual Hot Cocoa with Santa event, which, like everything else in the past 10 months, was virtual at the Southeast Health and Wellness Center. And he even recruited, wrangled, strong arms from other people to come with him to help out, which was amazing. So we would like to present the first Community Service Award to Elijah Stroud. Where's Elijah on the screen here? There he is. Hi, Elijah. You can unmute yourself.
Thank you so much. Yeah, I'm very honored to receive this award. I've really enjoyed getting to know everyone here and learning more about Central Health, and then being able to get my hands on with some of the work to help you all carry out the mission of promoting the health of everyone in our community. I've always very strongly believed that the relationships that we are able to make through serving are the most valuable ones that we can have. I'm really excited and looking forward to everyone here continuing to really stay involved with Central Health and give back. I know everyone here has been super involved with this program and done everything they can to make it a big success and really give back to Central Health in that way. So yeah, I'm really happy that we're to be able to serve our Travis County community in this way. So, yeah.
Thank you, Elijah. We really appreciate it. Virtual and not virtual claps. Our second Community Service Award goes to a person who jumped at the opportunity to support our many efforts this past year. When we needed help putting together PPE kits, they immediately reached out to their personal network and recruited volunteers to help set up PPE kits at home. And through this collaboration, 1,000 PPE kits were assembled, which is huge. And we're going to need more and more of those as we continue to move through this pandemic. So the second Community Service Award goes to Mega Upal. Mega? You can unmute yourself. There you are.
Hey, thank you, Mr. Burton. I also want to thank Anais and Yvonne, along with everyone at Central Health, for the tireless efforts towards the CHC program. I can't imagine how you pull this off, honestly, and also everything you do for the community. Elizabeth actually made volunteering extremely easy and truly accommodated to the request that I had, because I work with older adults, and I just got the older adults involved and engaged in the community. The volunteering to me is a special language which breaks barriers and goes beyond age and race. One of my favorite quotes that I look at on my wall all the time is, "Never doubt that a small group of thoughtful, committed citizens can change the world. In fact, it's the only thing that has," by Margaret Mead. So thank you, everybody.
Nice. What a great quote. Thank you so much. I'm getting verklempt. And next is our Outstanding Participation Award. This award goes to a member who has proven to be a prime example of a community health champion. And this particular person has been engaged with Central Health well before she ever became an official health champion. She's been a health champion for a very long time. She's a true leader in her community and works literally day in and day out to ensure that residents in her community in Del Valley and Hornsby Bend have equitable access to quality health care. She is a real champion. I have to say, she keeps us honest, which we really appreciate. Frank conversations, but always with the intent of making things better in our community. So this year's Outstanding Participation Award goes to Tina Byram. And I understand Tina's not with us today, but she did send us a short video clip, which the magicians behind the scene are going to play for us.
Hi, Central Health peeps. I am so sorry I can't be with you. I'm on deadline at work, so I'm not able to join you. I just wanted to thank Central Health for giving me the opportunity to become a healthcare champion, and I look forward to continue as alumni in the future. I wanted to say that I enjoyed the program. I loved the diversity course. I enjoyed the guest speakers. I enjoyed the presentations. I enjoyed learning about the Central Health Organization and how it works and all the intricacies. And it was a very enlightened program for me. I learned so much, and I hope to revisit those lessons and see how I could become a better advocate for my community. And it also gave me the opportunity to understand how to bridge the communication gap between my community and Central Health. And I'm very, very, very proud to be a healthcare champion, and I hope to continue in the alumni program as well. And I hope to see all of you soon. It was a great program. It was great making new friends, and I recommend this to anybody that wants to meet and understand and learn new things. It's a great program. Thank you very much, Central Health, and I hope you all have a great graduation. We all deserve it. Thank you, and have a great day.
Yay, Tina. Hopefully she'll watch the recording. This is being recorded. And finally, one final award. This is for the Alumni of the Year. There are so many incredible Central Health Health Champion alumni in our community, and I'm sure that somebody on this call will be in this position next year and a year to come. But we really are blown away by the ongoing support and participation of our alumni members. And today we're excited to announce our 2020 Alumni of the Year. This person was instrumental in the progress that we've made as an organization. They've given their time, they've opened their home for meetings prior to COVID, of course. I'm sure once we are in a place where we can do that again, they will. And they really have been instrumental in making sure that health equity training has come to the Central Health Enterprise. Thus, you heard from Jana earlier, who will be a huge part of that. So the Alumni of the Year award goes to Jessica Sager. Jessica? There's...
You're on mute, Jessica.
I'm scrolling.
You're on mute.
That.
There you go. We got you. We hear you now.
Okay. I was all like, I can hear me just fine. I'm super nervous about this. My heart is racing. My heart is racing because I feel that I am in the presence of giants and champions for change and social impact. And I am super honored for this. I'm really, really thankful to Central Health, to Anais and Yvonne, who put their heart and soul in making this amazing training happen, to my girl Rocky, who's also my co-chair for the Health Equity Committee this past year. It was I'm so proud to be a health champion, to mix a lot of quotes right now, because I heard quotes and I love them. You know, knowledge is power, as Uncle Ben told Peter Parker / Spider-Man. With great power comes great responsibility, and that we all have now. And that community is so critical, and that, you know, we have this opportunity to make a huge difference. So I'm super, super honored. And absolutely, yes, my house will be open to everybody. My backyard brunches will resume once we're vaccinated or we're far apart from each other in my backyard. But again, congratulations, Health Champions 2020. Super honored for this award and super excited for the things that we're going to be able to do together in the future too. So thank you guys so much.
Thank you so much. I'm going to turn it over to Yvonne next, but first I'm going to go off script for 1 second. And I do want to thank Yvonne and Anais they are my health champions at Central Health. I am honored and beyond fortunate to work with such talented, passionate, savvy, fun colleagues. And so I just wanted to let's all give them a quick shout out, because this program literally would not happen and could not continue without our Central Health internal health champions. So thank you, Yvonne and Anais. You guys rock it all the time, day in and day out. So thank you. Thanks to all of our recipients. And now, Yvonne, back to you.
Ted, you are so very welcome. At least from where I sit, you make things so easy and you're super supportive. So thank you back for making things super easy for us to do our work and enjoy it. So with that, I also want to thank Jessica for being such a excellent project manager for us. She really kept the ball rolling when it came to putting together the business case for the health equity training, and she's just overall an amazing individual. And also thank you everyone who got an award and everyone who's here present. I think we are capable of making great things happen if we just put our minds together. That's at least the way that I feel, having had the honor and privilege to have met you all and worked with some of you already. We would be remiss if we didn't recognize also our Alumni Association members and volunteers, some of which couldn't make it to today in 2020. And I don't know if we could show the slide. The following individuals volunteered in several activities, even though it was a very odd year. Together, they served about 34 hours supporting us at the Urban Health Expo, the MLK Day community event, the Hornsby Bend clinic grand opening back in February. And then we had a Hands for Hope Thanksgiving meal distribution event at El Buen Samaritano in November, Hot Cocoa with Santa at the Southeast Health and Wellness Center, assembling PPE kits, and also delivering welcome packets to the 2020 class. If you remember, you got some welcome packets at your front door. Some of our alumni members in the screen were able to make this happen. So thank you all so much for your support and help all along. Our 2020 Alumni Association members. So there we go. You'll see this bright group of folks on the screen. These are some of the people that were involved in 2020 in our Alumni Association in the Communications Committee, which supported us by creating monthly newsletters that included important COVID-19 updates, volunteer opportunities, and spotlighted our phenomenal alumni and the work that they do. And then also, although the pandemic halted our in-person gatherings, the event committee, Nora Comstock chairs, helped coordinate a virtual event on the public charge rule last summer. And that was very, very welcome and very helpful. So we appreciate Nora Comstock's efforts as well. And you may have also heard us talk about our Health Equity Projects Committee, which was instrumental in helping us build the business case to bring health equity training to enterprise employees. This business case was approved during the summer, as many of y'all know, and we are forever grateful for the time of these Health Equity Project Committee members and the commitment to this project as well, their commitment to this project. Thank you all so much for your continued commitment and for your support. With that, I'm going to turn it over to Anais.
Thank you, Yvonne. And thank you. Well, one, congratulations to all of our graduates. Once again, our special awardees and our volunteers that have just helped us, one, increase capacity within our outreach team, but also just supported us and are still on our team and cheering us on, whether it's, you know, on the sidelines or actually rolling up their sleeves and helping us work. So at our last workshop, if you remember, we shared information on the Community Health Champions Alumni Association. And today we are excited to welcome 22 new members from the 2020 cohort. That's more than half, so thank you all so much. If you would still like to join and haven't had a chance to let us know, just shoot us an email and we'd be happy to coordinate with you. Anytime that I'm asked what my favorite part of this program is, I always say that it's seeing our graduates within that transition period of finishing the program to becoming alumni, when they decide that they want to stick with Central Health and support our work, and they truly do become our health champions and you know, be a better champion in their community. And I like to say that it truly does take a village. So we appreciate you all committing to this and being on our team. And so on that note, I'm excited to share with you the 2021 Alumni Association. And chairing our communications committee is Beth Reese. Working alongside her is Leah Isger and Asa Malik and Shelly Gupta. Both Beth and Leah are from our 2018 cohort, and so we're really happy to have them back and still continuing to work with us. Chairing our events committee is Elijah Stroud from this year's cohort, and working alongside him is Nora Comstock from the 2019 cohort, and Catherine Turin, who also graduated this year. Our at-large member list is at 22 right now, and these at-large members will support Central Health through volunteer activities such as outreach and community events. They'll help us gather feedback for engagement activities, and they'll participate in research and evaluation for special health equity projects. So we are still in the process of finalizing an alumni president. We are still working on nominations, but we do hope to announce that that role in the later month of January. And we really do look forward to working alongside this bright and passionate group of people to help improve the health of our community. So thank you all again so much for staying involved. And we, like Jessica said, she'll have us over at her house and we'll celebrate. And we look forward to planning 2021 and all of the exciting activities that are to come. I'm going to stop sharing the screen here. And have we seen Mike Gieslin yet?
Before we, so Mike Gieslin is going to join us in a few minutes and say a few words, but I wanted to see if Maram was around. So our board member, Maram Musaitif, who was recognized at the beginning of the program, is also a health champion. She went through the program, I believe back in 2016, if I'm not mistaken. And she's always supportive of this program, and she's always asking us how the program is going. So Maram, I don't know if you want to just say a few words or anything like that off the cuff. I know this wasn't prepared, but just wanted to give you an opportunity to say a few words since you are a fellow health champion.
Well, thank you so much, Yvonne. Thank you, Ted, John, everyone, and Anais for this amazing program. I can't believe where it is and how it started. We were a small group. I am so proud of every single one of you and all the work that you are doing and continue to do. I'm inspired. I wish you all the best, and I look forward to seeing this work. And as earlier was mentioned, we're living unprecedented times that this COVID has impacted many of us. At the heart of us all is really the community and addressing their needs and being there for them. I wish you all the best and congratulations on your achievement, and congrats to you all. Thank you.
Thank you, Maram. We appreciate you being here. And well, with that, Mr. Gieslin, was going to join us, and he will be joining us soon, but we are very much ahead of schedule. So we want to just sort of turn it over to you all for some sort of, for you all to say a few words, whoever wants to say something, while we see if Mr. Gistin can join us here in a few minutes.
It looks like Mike is here.
Oh, great. Perfect timing. Yeah.
Sorry.
All right. Well, with that, we're going to turn it over to our president and CEO, Mike. Please take it away.
Yes, thank you, Vaughn. Thank you very much to all of you for being part of this Health Champions class. We're really excited about this, and thank you for not only your patience but your perseverance in this virtual environment. I believe this is our first class in an all virtual environment, and so this was as much a learning experience for us. But we're so grateful that you gave us your time and your patience and your passion for serving the community and bringing about health equity, even in this environment that we're in, because if there was ever a critical time, it's now. Central Health, we are privileged to fund a healthcare system to provide access to care that at any given time in any month serves about 50,000 people. And it is important to us that each and every one of those people receives the highest quality care, the best possible outcomes, in the most equitable means and through the most equitable outcome, and really providing access to care to those that need it most. And you all are going to be a part of that. You've heard a lot about that in the seminars that have been part of the Health Champions training. As you think about, Central Health in the future and how you can interact and be engaged and advocates in the community, we're embarked on some pretty bold visioning and reality exercises. It's one thing to have ideas, but it's another thing to say, okay, where are we going to start lining up strategic investments to start closing gaps and disparities in the system so that you truly are able to achieve an equitable health system. And that's some of the work that I see our board of managers here today that, in fact, just as recently as yesterday, we were meeting on and talking about our systems-based approach to health equity. Of course, you'll continue to see us in and around the community and on the airwaves with our communications and outreach. I mean, that's always going to be a critical part of what we do, especially in this pandemic as we enter into this time where trying to get vaccines and administering vaccines and working with our partners and APH and others in the most equitable manner into those areas that are high risk, high impact, and underserved, and living at poverty levels. And so you'll see us out and about working on that. And there is so much more that I could go through. Those are just two examples. But what we're doing here in the healthcare district, it's not just providing a system. It is thinking beyond just the day-to-day, providing a system and really big and really far into the future, and then making that a reality. So that's what I want to leave you with today, and hope that you all will continue to stay connected to us and get engaged in the alumni program. I don't know about you, but I look forward to the day when we can have events again. And while the PPE events and the vaccine events have been amazing, there's a lot of things that we can do together to continue to interact and serve the community that we are so privileged to serve. And so I look forward to seeing everybody at events, knock on wood, if you don't mind, sometime in the very, very near future. So that concludes my remarks. And again, thank you all, and stay safe and well in the meantime.
Thank you, Mike. We appreciate you being here. Thank you so much. Congratulations, everyone. As mentioned earlier, this work is ongoing change, especially systemic change doesn't happen in a matter of 5 months, which is the duration of this program. So we look forward to working with you on what lies ahead. We're excited about two things. We're excited about many things, but we're excited about two special things. One of them is, for the first time ever, we took this program virtual. And we had so many doubts about it, we hesitated so much about it, but we went through it, and lo and behold, the second thing that we're very excited about, we increased our program completion rate from 88% last year in 2019 to 93% in 2020, despite the program being virtual. So that's especially exciting. So again, we're so happy to have you guys join our Alumni Association, many of you, and we look forward to continuing to work with you. This concludes the program section of our of the